I'm Alistair Greener. I'm travelling to Uganda with physicians across continents to see for myself some of the most medically deprived communities and how this charity is making a difference to so many lives.
Thank you very much, sir.
Thank you.
Along my journey, I meet the people of this vibrant country and witness hospital facilities, long overdue surgeries.
Get out. Yeah. He's feeling sick, yeah.
And see the challenges experienced by the people who live here. Many of us take for granted what we have when it comes to medical care. How long would it have taken for that to get to that size?
8 years.
8 years. The boy has malaria.
Yeah.
But how do the people of Uganda cope with the harsh reality of living on such limited resources? We're on a 45-minute ferry journey to Buvuma Island. Now, being one of the most remote, it's also one of the poorest, which is why we're coming along with some doctors and also supplies from physicians across continents. And it's going to be fascinating to see the impact that they have on an island where just basic medicines are in such short supply.
This island is the second largest island in Lake Victoria. And the largest is Kalangala. But what makes this one different is the fact that the populations living here are 1,500 people. And then it's so much dilapidated and a little bit of people who are poor, hard to reach area. So there's no interest here, so people are lagging behind in terms of facility.
So they're not looked after as much as other places in Uganda?
Of course, because look at the population they have and what do they have? Do they cultivate? Do they have a bigger business that is bringing money here? So these are some of the challenges that they are facing, and it has hindered the development in this area.
There are so many people who've come far and wide to this camp for treatment. I'm talking to Dr. Saad to find out more.
This camp had been arranged by BAC for the last 10 weeks. We had been in contacts with the local health authority here in Buvuma Island and with our coordinator in Kampala. And we chose to do a medical and pediatric mission in the island.
Could you give me an idea of the sort of training that you've been doing here in Buvuma?
It is a medical as well as a pediatric trainings. The local doctors as well as the nurses and technicians is learning from our senior staffs, and they keep consulting our senior staffs for more complicated, difficult cases. And they are really very happy about it, and we are very happy because training is very important for doctors and nurses to keep their medical educations and to be updated about the recent changes in medicine.
am Dr. Abdullah Al-Zaidi. I am from Saudi Arabia. I am a general practitioner there. I came here to this medical campaign to help people of Uganda. This is for you, for general. Use it as advice, and you wash your hand regularly, and eat healthy food, clean food. Okay, this is general advice for all people, yani. Okay. So, and avoid mosquito bite by putting the mosquito net.
Sleeping under the mosquito net.
Yes, exactly. Because we want to prevent malaria. Malaria is common here.
I know.
And make people sick. So we want to prevent it by mosquito net, to put mosquito net.
Tell me a bit about how you came to be part of this program here. How did you hear about it, and how did you end up here in Uganda?
Actually, I have this in mind before that. I want to visit Africa to help poor people, but I don't know how. Then I have a call from my friend to that there is a campaign, medical campaign, and we want you to participate as a physician. So I was so excited to be here to help part of Africa. This is the pharmacy.
The pharmacy.
Yes, you can get the medicine from the pharmacy. Give the paper to the pharmacist.
The man.
Yes, they're the man. Okay. Yes. Nice to meet you. Thank you.
Tell me a little bit about the patient you've just seen. Is that a very typical kind of consultation that you would have?
Actually, it is different from in our country, in Saudi Arabia. Here we face a different patients. The main issues that we can give him education apart from the medicine. We have different, mainly infectious disease we have here.
So it's infectious diseases
yes,
are
number
the
one.
biggest problem.
Like malaria, like HIV. This is the biggest problem here in Uganda.
I'm amazed how patient people are waiting in the searing heat for their turn to be seen by the medical team. Meanwhile, I'm watching a father and son being tested for HIV and malaria.
Actually, when we are testing for HIV, we have 3 stages. There is one which is called determine. This one is called determine. It's the first strip we use before we go to other strips. For it screens out all virus infections.
And how did he get on with the malaria?
This one is showing positive, and this one is showing negative.
So is it the father who has malaria or the boy?
Kid.
The boy has malaria.
Yeah.
So now he will get treatment for that.
We get write for him the lab report, then they take back to the physician. Physician prescribes, and then to the pharmacy, and they dispense the rest.
What we've just seen in there is very typical of people who present at this particular camp. The father brought his boy here because he had swelling down the side here, and he was also very lethargic. So the doctors over here decided to give him a malaria test, which is what we've just seen. And unfortunately, it shows that the boy does indeed have malaria. But the good news is that he will now be prescribed some drugs, and those medicines will hopefully make him better within about 3 or 4 days. And this is just one of maybe, 150 cases we'll see today. Tell me a few stories of people that you've helped here.
The patient who came in with diabetes, he was really bad off. If you look at him, he had malaise, weak, and he had taken time without having the medication. The sugars were too high. He's urinating frequently, his vision, he could not see very well. So we immediately gave him the medications. He started taking routinely like he has been taking. And after 2 days, he comes back telling us, you know what, I can at least now see properly. I'm not going so frequently to the toilet. And he was really so happy because majority of them are told, you know what, it's incurable and you will die. So giving such person of such medications and hope, the person feels like, wow.
Early next morning, we make a long journey to a remote village on the other side of Buvuma to get a better understanding of rural life on the island and the healthcare challenges the community faces.
Amaina gange ninze nabiri esalimati emyaka ejange giri 5 na mulala. Obuzibu bwenfunye wano mu Kikongo wempangalira wentyaime ekisooka ndi mukazi na mwana sadange yanfa ku 82 mwezi gwa 8 nga lulala. Ndina abaana bange, abaana bali 5. Buti obuzibu bwendagaine wano tuzira kibanda. Tuli mu bupolotanga buno. Buti abaana bange bali owundi kasoma kya 10 owundi kya 11 ayo obusobozi mbuzira tibasoma bali eyo batyaime. Nze mwene nalwala ani yadanuma wano najeeye walukuba eyo mubagala bansalaniya ayo kuva okwo mundera muno munuma aye n'akasente akagula ikerenda nkazira.
And this is your house?
Eyenda kungwako yatike yona obulirinzira ntenduka gegamo otimbwa ekyokulya nzira.
And the water's leaking through here. I can see the damp coming through here.
Buti n'embeera y'amaadi tuzira maadi edwaliro tuzira okumpi okuva n'okujja ewa Rwanda okozesa emitwalo 2 okujja n'okwira then tasobola kwetuusaako. Aye enumizibwa ino omugongo gunuma ensigedo omugongo mulempulira oti divaamu endera dino dinumira era dituuda butuude.
So what do we have here?
Okay, this is a prescription which was done in KYM Nile Hospital. That is in Jinja, Walukuba.
So she would have taken 3 hours across on the boat, yeah?
That's the one, that's the place.
Yeah.
And then she had an infected wound. She was diagnosed with an infected wound. The way she told you, she had hernia, and then she was operated. So the wound got infected.
And this is back in July,
that is in
June last year.
June last year. So I guess since then she hasn't had any medical attention.
Waverley. Waverley. Word has spread through the village that we're here, and I've been asked to meet another lady who wants to tell us her story.
Kati ffe bano tubonaabona era embeera mbi tuzira bwe tulya nga tuwefumbiikirizaawo nga bupaani butyo oba toofune kyakulya n'enumba eno mbi n'entenduka mbi era amaadi gatoona gankuba era muno twona buti tudaaga kuba tuzira we tulimira baatutoolako buti n'amadwaliro we tulwalira kitamiiro ate okuva kano okutuuka ekitamiiro mitwalo 2 male watuuka ekitamiiro era ife muno tuzira mbeera nungi tubonaabona ino okulya n'okunwa titufuna kubanga nze nzira musaada ndina mwandu abaana boona baafa abasinga bungi ndi wano mbonaabonera wano nze ndwala alusa ne puleesa ne biinuma embeera yali mbi naajja aye buti nalekera buti mwaka mulamba nga tijjaayo olw'embeera lw'okubula ssente.
Much to my surprise, Dr. Jamada tells me that we can take the two ladies back to the camp with us to receive treatment. What an incredible thing that we've been able to be a part of today. We're helping just two ladies who are among many here who need help, but two is better than we would have done if we hadn't have come here today, and that's thanks to physicians across continents.
Wano ntuuse mu Kikongo.
Chikongo. Chikongo.
Chikongo.
Okay. Well, Chikongo is where we have just been, and we're now on a very rough track, which is actually a bit of a main road, to get our way to the hospital, which is about an hour away, where these ladies will both be treated. And, you know, just coming back from that village where you saw so many people, a lot of happiness, but also a lot of suffering because of the lack of medical facilities. And for that village, they either have the choice to take a 3-hour boat trip across to Jinja, or they take this rough track to a near medical centre. The nearest basic medical centre is about 20 minutes away. We're going to the hospital where physicians across continents are working, which is about 1 hour away. That's amazing, just seeing what's happened to those ladies. Talk me through what's just happened in terms of the medicines that they were given.
Yeah, as we said, they came from very far, 5 miles away. We came with them. I checked in with them so that they could get their medications faster. So I took them to the doctors. They were screened and examined, and then they went to the front to get their medications. Immediately I was done with it. They managed to take their motorbikes back to the place where we found them.
And what impact will it actually have on their day-to-day life, having this medication? How will it change the way they live every day?
It would change. Why? Because first of all, I'm sure they will be healthy, or we control the hypertension. And the moment the hypertension is controlled, they'll be in position to work. And the few token I've given them to push them to do the daily activity, like the other lady who is making pancakes, it will increase in the business, and so that you could get more profits, and you make a difference of life. Just a simple token which could make someone push to where he has been to a certain level, so that he could earn more and then take care of himself or herself.
What an incredible day. I mean, when you think about it, those were two ladies who would never have dreamed that what happened today actually took place.
They were really so happy, and they left happy, and they really have to tell the other people in the villages that, you know what, a physician across continents came and helped us out, and here we are.
Well, thank you so much for everything you've done, especially today, and for changing two people's lives beyond recognition. It's just amazing. Thank you so much. And that, nothing else can be said apart from that is how physicians across continents make a real difference.
being here, a mother, father, who is having a child who's sick, living in a grass-hatched house, by coming here and giving them these services, they're so much appreciative, and gives us a reward as Muslims that saving someone's life is really a noble goal. Because in Islam, when you save one, it's as if you've saved the whole of mankind. So this is the principle, I guess, physicians across the continent are putting forward, and it has really helped us. Any donor, any individual who gives in his money, that money is not a dead money. It has saved someone's life, it has multiplied in millions. We all fall sick, rich and poor. So why not reach out to the person who can't afford? Why not reach out to that person who feels like life has come to an end? Why not reach out to that mother to save a child?
Well, our 2-day visit to Buvuma is about to come to an end, but what an incredible 2 days it's been. We've seen the physicians across the continent look after maybe 400 people, and as the word spread, more and more people kept coming to the camp. But the thing that really struck me was how patient everyone was. They just sat there for hours in the sun waiting to be looked after, and absolutely no one was turned away. This is a very poor area, and it is in desperate need of help, and it's been inspirational just to watch the physicians across continents do their work and bring some light to the lives of people who have been so appreciative of everything that they've had. A truly inspiring experience. Next time, I go back to the mainland and travel to Jinja. I visit one of its hospitals. So I'm going to need to get some air. Okay. And witness the very basic conditions where doctors perform more life-changing surgeries.
If this happens far away from a hospital, she might lose her life.